Now, this will be our first video to the concept of neonatal sepsis, alright, where we are actually taking time to look at the introduction to the concept of neonatal sepsis. So for what we have here, I'll just tell you guys what I understand by neonatal sepsis as a student level. Alright, so sepsis in general, we're trying to say there's a bloodstream infection, like you had a bacterial infection somewhere. So these organisms, they struggle till they got into your bloodstream. Now when they get into your bloodstream, it's of great advantage to them, because for them to be able to spread, it will not be any stress. It will just be fluent, they will just be spreading anyhow. Do you understand? So neonatal sepsis is when it's happening in neonate. A neonate is a newborn baby. Any baby that has not gone past 28 days old is a neonate. So of course, if this kind of thing happens in neonates, if it happens in adults, there's still issues. They imagine it happens in a newborn baby that is kind of like almost helpless. Okay, so we study this because it's a very common cause of children dying, okay, after childbirth. So it's actually a life-threatening condition. It affects newborn. So newborn is somebody that is between the first 28 days of life. All right. So it usually occurs when the baby's body mounts an overwhelming immune response. So there's an infection, bloodstream infection. Your immune system is trying to react and kill the organisms, but it also has some effects on you. Okay, so the organisms causing those infections could be bacteria, could be fungi, could be viruses. So the whole response there could cause a lot of inflammation, could cause tissue damage, could cause organ failure if not treated promptly. So the key concept in neonatal sepsis is a systemic infection, right? So it's in the bloodstream, it's going all over, systems. So it can present with subtle or non-specific symptoms, okay? So making early diagnosis very challenging, okay? So classification, we have the one that is occurring within the first 72 hours of life, that's like 3 days. Then anything after this first 3 days of life, but up to 28 days. Alright, that one is a late onset neonatal sepsis. So this picture here kind of like define them. Okay, this picture define them. You can just pause and look at it. Some people say 30 days, but in Africa, okay, we say it's actually 28 days, or at least in Nigeria. So common organisms that usually cause those issues in newborns, we have things like the group B streptococcus, Escherichia coli, Staphylococcus aureus, Klebsiella, Pseudomonas, Candida species. Okay, so it's either you are dealing with viruses or bacteria or fungi most of the times, with bacteria being the most common cause. Okay, so why it matters, newborns, mostly the ones that are born premature, are usually affected by this, or they are born with low birth weight. Okay, so of course their immune system too, okay, is following a pattern of how their body is growing. Okay, so the immune system is vulnerable, so sepsis can rapidly spread. So if you don't bring up a timely intervention, it could lead to septic shock. Many organs could start actually failing in the body, then it could actually lead to the death of the baby. Okay, so this is the introduction to neonatal sepsis. We go on, we'll talk about many other aspects of it, like clinical features, how to investigate, how to treat, maternal factors, that's issues from the mother causing issues in the baby. All right, hospital acquired, community acquired. We'll talk about all of that later on in the lectures.